bringing the specifics to us even before Rob Dansero did on how to get them. So thank you. All right. Well, the reason why we're here today is to hear from three very important organizations. Ray Mowry serves as our chair of the Local Community Service Committee. As you know, local community service is one of the other areas that really allows us to stand apart from a lot of organizations in town. We have the funding, we have the support, but most of all, we have the passion of the committee members and the selection committee that goes through these nominations or these applications to fine tune to a finalist list that is truly remarkable, as you're going to get here today. I'm now going to turn it over to Chairman Ray Mowry to introduce our finalists so that they can have the floor. And again, they have their amount of time that they're going to speak. Please respect that. If you need to leave, that's fine. But we're not going to cut into the amount that we budgeted for them. So thank you.
Thank you, President Chris. And I'll do the same so that everybody can. I just quickly, if everyone that's on the committee would stand up today so they could recognize. And as Chris said, it really is hard because we have, the last few years, I've served on this committee for several years, and we do get worthy causes, and a lot of times it is hard for us to narrow down who really does we'd like to give the money to the most. But anyway, I'm going to shut up because, as Chris said, we do have time. I could stand up here and keep talking all afternoon, and we're going to do this in alphabetical order as well. And so I'll call up East Tennessee Freedom Schools first.
Good afternoon.
Good afternoon. Hello.
I wrote stuff down because I'm very passionate about this, and I will take longer than 5 minutes if I can write this down. My name is Denise Dean, and I'm the Executive Director of East Tennessee Freedom Schools, which is a free 6-week summer literacy and empowerment program. We're delighted to be here to talk to you about our program for the next 5 minutes. Freedom Schools was created and provided to us by the Children's Defense Fund, which is a national child policy organization. The Children's Defense Fund was founded by Marion Wright Edelman in 1973. East Tennessee Freedom Schools was founded in 2017. Our vision is a more just world, and we aim to get there by leveraging literacy with a diverse community of children to do 3 things. First, to reduce summer learning loss. Second, we want to increase the love of learning and reading. And third, we want to develop thoughtful and engaged citizens. We believe Freedom Schools aligns well with Rotary's vision of together, we see a world where people unite and take action to create lasting change. The primary aim of Freedom Schools is to reduce summer learning loss. We want to help scholars retain and grow their knowledge base. We do that with reading, discussing, and working with the themes and content of age-appropriate multicultural books. We aim to strengthen the key skills of comprehension and critical thinking, and we do our work in fun and engaging ways. Our theme of I Can Make a Difference has 6 sub-themes. I can make a difference in myself, I can make a difference in my family, my community, my country, and the world, and I do that with hope, education, and action. We aim, each day we deliver the curriculum and discuss the books with our scholars in the context of each of these sub-themes. Our theme of making a difference also informs what we do to develop thoughtful and engaged citizens. Our curriculum is comprised of books that represent all aspects of humanity. Our books act like mirrors and windows. Mirrors are books that have images that look like our scholars and stories that are familiar to them, and that tells them they matter, and that is affirming. Windows are the books that give scholars views into other cultures, places, and lifestyles. They see people that are different from them in some way, and that facilitates understanding and empathy. And each week, our scholars choose a book to take home so they can build or grow their home library. This next chart's gonna be really busy. I just have 4 points on it. First, the people. We hire college students to be our teachers. We call them servant leader interns. The servant leader interns and the K-8 scholars create a relationship in a classroom where there's a ratio of 1 to 10. That's helpful for developing relationships, facilitating discussions, and effectively handling classroom management. The people that we work with and the people we serve, that's our future workforce, our future taxpayers, our future voters, and our future leaders. The second thing I'll point out is the second thing that happens in our day is Harambe. It's a Kiswahili word that stands for let's go together. That's where you guys come in. It's a pep rally, we have a lot of fun, but we invite people like you to come in and be a read aloud guest, like Dean Bridgman did this past summer, right? Because we want our scholars to see that everybody reads, regardless of their job, their station in life, what have you. And not only do they read, they enjoy reading. Second, I'll point to the integrated reading curriculum. This is our Bible for our program. And that's when our kids get to swim and work with all of these multicultural books. That's where they get to really hone their comprehension and critical thinking skills. In over 6 weeks, they have 90 hours of that. Lastly, I'll talk about the afternoon activities, which are broadening experiences. We do STEM, we do drumming, we do fitness, we do math. And sadly, about 2 years ago, we found out we had to do phonics. We started getting first and second graders who could not say the alphabet. That was a problem. Now, I think this is a great program, and we offer it for free. So we had to figure out, how do we raise money to do all of this, right? So we had to find an answer to the question, why is Freedom Schools needed? And since our focus is literacy, we looked at the performance of the school systems. We learned that in the area of literacy in ELA, we could help. We had an opportunity to make a difference. 59%, this is 2024 data, 59% of our 3rd through 12th graders in these 3 school districts are not reading on grade level. That's 6 out of 10 of our future workforce, not reading on grade level. When you look at students characterized as Black, Hispanic, and economically disadvantaged, the numbers jump up almost 23% points. East Tennessee cannot be the best we can be with this kind of performance, and we want to help with that. One of the ways that we help is to work with the 3 categories of students that have been most challenged in this area. And that happens even though we're a first come, first served kind of program. You'll see that the majority of the scholars that we serve are Black, some are Hispanic, but overwhelmingly, 85% are categorized as economically disadvantaged as they are eligible for free or reduced lunch. Now, we've worked with these scholars over 8 years, and we're proud of the impact we've made. Our scholar data comes from pre and post assessments, and at the end of the program, we survey our parents, caregivers, and SLIs so we get their perspective too. We like these numbers. 84% of the children that we work with, right, did not experience summer learning loss. That makes a big difference come the fall. I'll wrap up with one of the more empowering aspects of our program, our National Day of Social Action. This is an essential part of what we do to develop thoughtful and engaged citizens. Each summer, Children's Defense Fund at a national level identifies an issue that has negative implications for our country, the scholars, and their families. And we raise our voices about it. Our scholars research, think critically about, and discuss the issue. Collectively, we decide how we're going to raise our voices. This summer, the focus was on stopping the banning of books. The background photo here is from the summer of 22, when the theme that year was on the climate crisis. At that time, our scholars were inspired by the book, The Lorax. By the way, it's also banned. In other sources, they researched about trees, and they learned that trees help the climate crisis. So we planted fruit trees in the front lawn of Beck Cultural Exchange on Dandridge Avenue. On these days, we really want our scholars to get their hands dirty as they strive to make a difference. Now, Rotary Club of Knoxville, you have a chance to make a difference by investing in East Tennessee Freedom Schools so there can be lasting change in our community. Thank you for your time.
Does anybody have any questions?
How many children do you serve?
We aim to serve up to 130.
Sorry.
130. Yes.
I saw that only 2% Hispanic students.
Yes.
So have you thought of partnering with the center to increase the?
I talk with Megan and Claudia a lot. Most of our Latino children are actually at our one county site. We've only had like maybe 2 or 3 I've actually tried to encourage Central to open a Freedom School site. That would be ideal.
And I should have mentioned earlier as well, Allison will be, if you think of a question later, Allison will be sending out with the vote, she'll be sending you their presentations so that you'll have a little bit of a review material if you should have a question. Okay, next up is Friends of Literacy.
Luckily Denise and I are the same height, so this worked out. Thank you guys for having us. I am Wendy Wan, the Executive Director of Friends of Literacy, and I've brought with me our Board President, Harry, who's sitting over here. And then I'm gonna let my staff introduce themselves as well.
Hello, thank you again for allowing us to be here. I'm Kristen Yarnell, our Program Director.
And I'm Samantha Kistner, I'm the Program Assistant.
Before I get started, I would like all of you to just take a breath, and I want you to think for just a quick moment and picture your home growing up. Did you have books there? Did you see your parents reading? Did they encourage you to read? And what about your home now? Just keep thinking about yourself, okay? Okay. The mission of Friends of Literacy is to transform lives through literacy and foster a lifelong love of reading. We work to ensure that all children have early access to literacy skills that they need to be kindergarten ready, and that all parents are empowered to be their child's first teacher. We have a lot of research to back up a lot of things you just heard from Denise, which is wonderful. I'm glad you went first, girl. That's great. Great. Hi. Okay. Cool. We know that children from low-income families start kindergarten 12 to 14 months behind in their language and pre-reading skills compared to children in higher-income families. Also, only about 39% of low-income households even have books in their homes. And when kids start preschool, 34% of preschool children from low-income homes are read to daily, 34%. The reason why I'm telling you all this, and there's other data up here to show this too, is that children who read with parents are 3 or more times likely, 3 times a week, are twice as likely to develop the skills needed for literacy competency. And having books in your home is the single biggest indicator for somebody's academic success. It is not your income. It is not your parents' education. It is not your family's composition or any of these other factors that we talk about so regularly. Obviously, those are insurmountable. However, reading and access to books at an early age is the #1 indicator to move a child out of poverty. That's why we do what we do. We do everything we can to make sure kids here in Knoxville have access to low-income households, have equal access to those books before they even get to school. And we do that effectively by reaching them where they already are. Currently, we have a partnership with Cherokee Health Systems, which, as you may know, is a federally qualified healthcare center that serves under and uninsured individuals. We go where they are, and at every single visit, those kids are getting a when they very first start, that very first visit as a newborn baby, their moms are getting a mommy and me pack. We have right here. We also have in the back and some examples of the books we give out as well. We make sure those kids are getting their books. And the goals of this is to build their home libraries, empower parents and caregivers to be their child's first teacher, and establish nightly routines for consistency. Our Brush Book Bed program is the most effective way that we're able to do that. And we do this through a program that was developed by the American Academy for Pediatrics in partnership with Delta Dental, where at every well-checked visit, kids are getting books as well as dental packs and things like that to start that program. This looks like this. If I'm an infant, I'm gonna get that mommy and me pack we just showed you. And then at every single one of those well visits, because if anybody's had a baby, you know you go to the doctor all the time, I get a book. And then when my kid continues to go for their well checks all the way up through preschool age, I'm going to get a book at every single one of those visits as well. And what this looks like in case of numbers is roughly we're giving out about 320 literacy packs to newborn babies in the Knox County area, as well as an additional 2,900 books distributed over the course of each year. This impacts 2,300 kids in our Knox County clinics alone. This costs us about $33,000 a year, and we're asking $10,000 from you, which is really just a $4.34 investment per child to build that home library and make an impact in those households. $4.34 to impact those parents who love their kids just as much as we all love our kids and grandkids and nieces and nephews. $4.34 to change the trajectory of a child's life. That's what we're asking. And we could use your help, not just your money, but your time. We love time and treasure, you guys. We could use your time. We definitely have time and volunteer services to assemble these packs. We're it. This is it. This is our whole staff, okay? We need help assembling these packs, sorting, labeling, and shelving these books. The books you see back there all come with a special label on them to give guided lessons to their parents as they go home with those books and things like that. And we can use all the help we can get. There's lots of ways we can engage with you. So in my very quick, brief presentation, thank you. Thank you for your time. And I want to end with how I started, which is having a book in your home is the single biggest indicator for academic success. Just giving access to those books, supporting those parents who, regardless of their life, are struggling, getting an access to a book changes their lives. So thank you very much for your time.
Any questions? Susan?
So when the kids grow out of those books, do you recycle and do you get them back to give them to other kids?
So they are using those books to build their own home libraries. There's going to be younger children that those are going through. And then sure, we don't get those back. Those belong to those families, and hopefully they're passed along to different generations.
Virginia?
Excuse me. Do you do anything for getting, while you're giving out these packs, to try to get the families to sign up for Imagination Library also?
Yes, so in the Mommy and Me pack, there are 5 new board books. There's 3 educational toys. There's instructions for parents on how to read the enclosed books with your child. Not all of us have that model for us. So how to read if you don't speak English or read English, how to get a picture walk through a book, as well as other community resources. So Imagination Library, Parents as Teachers is another organization in our town. Storytime at the Knoxville Library and any other library or Storytime we can think of are added in there. So there's a wealth of information. And then it's presented to the families by a nurse practitioner or a pediatrician that's meeting with that family. So they are also modeling. Here's a book for your 2-month-old. And yes, it's okay if you just read them a book while you're snuggling with them. Here's how you read a book if you're 18-month-old. It's okay if they're walking around while you do so. And kind of modeling and sharing that information of what it looks like at any given age. Thank you.
Paul?
You said 34% of these kids are being read to, so 66% are not being read to. Is there any data about what percentage of those parents and those families are able or unable to read?
I do not know.
What a great question.
I would imagine it's probably partially significant. I would say there's probably some. So in Knox County, we know, the last data I have in my head anyway, is about 10% of Knox County cannot read adults, are not functionally literate. So they can read some, so they might be able to read a board book to their child, but they're not participating in society. So it's kind of a hard thing to kind of track that functionally illiterate, but most people probably could read with their child, they just don't have the knowledge that it makes a huge impact.
Anyone else?
Thank you.
Thank you. Can you hear me? Can you, are we working? We're working now, good. I now call up Interfaith Health Clinic.
Boy, got 2 hard acts to follow.
Thank you for, my name is Melissa Nutt, and, yes, Kelly is going to operate the clicker. I can talk and do a lot of things, but I get excited about what I'm talking about, and then I never click the button, so she's in charge of that. I'm Melissa Nutt, the Executive Director of Interfaith Health Center, and I want to thank you all, just like these other two organizations, for giving us the opportunity today to share about what we're doing, what's going on, and to give you the opportunity to participate. I'm not going to talk a lot about what we do, simply because I was just here in June, but to kind of recap, Interfaith Health Center is a nonprofit organization. We are one of the few in the state that literally have all of our patients are uninsured. We don't take anybody with any form of insurance. We don't have any, federal organizations that help us. Everybody that walks through our doors are the uninsured populations. And there's just not many organizations around there that's not some type of hybrid. In our organization, we truly provide comprehensive care, primary medical, general dentistry, counseling, and we have access to prescription medications. When I say primary medical, we're doing prevention, we've got wellness classes, we're doing diabetic classes, we're doing chronic disease management, we're treating acute problems, we're taking care of the entire scope. We have access to specialists and hospitalizations. In our dental services, we're providing not just fillings and extractions, but we're doing crowns, root canals, dentures, again, the whole gamut. Mental health, we're treating a wide array, trauma issues. We're dealing with everything again, and we partner with a lot of organizations. You can see that was a theme for our other organizations. We work really hard with Helen Ross McNabb to provide our psychiatric services on site with us. And so we have offered the full gamut of mental health services, everything that is outpatient. We don't do any inpatient mental health. And then we offer assistance to prescription medications. So that's kind of the breadth of what we do. We've been in existence 33, soon to be 34 years. During that time, we have taken care of over 28,000 unduplicated individuals, soon to be 29,000. We're getting closer and closer to that mark every day. We're well over 400,000 different visits if you look at medical, dental, mental health, and across the board. So you're not still doing it 33, 34 years later if there's not an unmet need that somebody needs to meet. I'm here today, and I kind of skipped over that first little slide. When I was here in June, I was just talking about everything we were doing, and Frank Rockamell called me out and said, "You don't get to leave till you tell about your expansion." We have not gone public with that. What we're here to actually, at that point in time, so it's come full circle, because this was the first time I talked about it publicly, and I'm coming back today to talk about it. We are all hoping that you all will find it in your hearts to make a one-time $2,000 contribution to outfit 2 medical exam rooms. And so there is the need for this. We have no geographical boundary, but 86% of our patients are from Knox County, and in Knox County alone, there's 37,000 that don't have health insurance. 46% of those, and I know you can read, and that's the reason we had people, but 46% of those individuals are not receiving the health care they need because they just don't know where to go to get it. 60% of those, because our patients are all working, they get up and go to work every day, 60% of them, their employer does not offer them health insurance. I get excited every time I look at this. This is going to be our new facility. We currently, while we're integrated care, we believe in integrated care, everything in one building, we've had to keep serving more people. We've had to split into 4 individual buildings. And it's just not as efficient, it's not as effective, and we're trying to bring everybody back under one roof while also giving us the opportunity to serve more people. Right now, between the 4 buildings we're in, we've got about 14,000 square feet. This building will give us 23,000 square feet. Our ultimate goal is to, in 2 years, serve twice as many people as we are now, and in 3 years, in 5 years, 3 times as big. Boy, how about got that backwards? I really painted myself into a corner. 9,000 square feet, when it's just laid out the way it's supposed to. I can't tell you the impact that it makes, that if somebody is in to see the medical staff and they do some type of swab and they see something on the side of the mouth and they can walk down the hall and grab a dentist to do an immediate oral cancer screening, not tell somebody you need to go to the dentist because we think you might have oral cancer. I'm gonna stick my head in the sand, baby, you know what I mean, and never pursue that. But with this, they can do it. Tell somebody who's taking off from their job where they don't have health insurance, they probably don't have paid time off, and they go to the dentist and their blood pressure is too high, that dentist is afraid to treat them, and they go down the hall and grab a physician and bring them back and give them something to bring that blood pressure down so that their time off from work is not wasted and they can go ahead and see the dentist. We just gotta get everybody back under one roof. This is what we're hoping that you all will do to make a one-time investment. Now, I'm gonna tell you, Aaron's gonna look better than that picture, but make a one-time $10,000 investment to completely outfit the equipment, from floor lamps to the exam tables to the blood pressure cuffs that we need in 2 different rooms. $10,000 will allow us to do that. What's the impact? I've already described a little bit about how that impact works, but the healthier you are, the better able you take care of your family. It's kind of like physically, just like with reading. If you can't read, you can't read to your child. If you don't feel like getting up and moving, how do you cook a meal for your child? How do you read for your child if you don't feel like getting up out of bed? If your diabetes is so bad that you can't see the words on a page, the impact is great. Healthcare is the #1 thing to take somebody, even if they're middle class, into poverty. Healthcare costs are the #1 reason that people spiral down. It is one of the top 3 lists for why somebody who owns a home becomes homeless. So there is an impact. You're gonna watch a quick video of a gentleman, and then I'm gonna tell you the rest of the story. But I wanted you to see his face so I can tell you the rest of the story.
At the time, have any insurance. I had to drop the doctor that I was going to in Morristown because I couldn't afford to pay him. Blood pressure, steel pills, you're just looking for something to happen. So he was telling me about what Interfaith did and how they help people. I had my neck operated on, where I had 4 discs that had collapsed. I could never have been in a situation where I could have afforded to have that done. I mean, it's almost $100,000 to have that done, and with no insurance. Here, take my house, take my 2 children. You have them to work for you the rest of their lives. And it's just amazing that there's people in this world that will help other people.
While what Chris shared is very nice, and it impacted his life, the rest of the story is that Chris's 2 kids were college age when he hit upon these hard times due to his neck, and then his other issues like high blood pressure. He couldn't have the surgery, even if he had health insurance. He had to get that taken care of and then figure out how he was gonna pay for his neck surgery. So his son dropped out of college. Say, Dad, you taking care of us our entire lives. So it's my turn to take care of you. So his son dropped out of college, went and got a job to support his dad because his dad couldn't get the health care he needed to go back to work. They found out about Interfaith. He became our patient. Dale got the surgery he needed, went back to work. His son went back to college, has now finished his college degree. This is an opportunity that you have before you today with 3 different organizations, and of course but to make a one-time investment into generational opportunity to serve people. The people that gave the money that helped us get Dale to where he needed to be made a one-time gift, but it impacted not just Dale's life, but his children's lives. So, thank you very much for giving us the opportunity. Here's some of our current partners, and just thank you for the opportunity on their behalf as well as theirs.
Anyone have any questions? Oh, Michael?
Is there a volunteer component within the state?
Yes, we have a host of volunteers. We have both in medical, dental, mental health and all that. We also have what I would call just lay people. We have people who help with fundraisers. We have people who help with mailings. There's always opportunities for volunteering.
Where's the new space going to be located?
It is going to be at 7005 Middle Road. We wanted somewhere that was still on a bus line, even though we are fortunate that we've been able to write a grant that is paying for Uber Health rides and other things so that we can pick up people from other counties and bring them in. We also wanted some place that was still kind of centrally located with a lot of the healthcare, and has kind of become healthcare central. Close to the interstate, so it checked all of the boxes. It's going to be 7005 Middle Road.
Any more? Okay, all right, thank you. All right, everybody. Any other questions? Does anybody have a question? Anything else? Any other? All right, as I said, I want to thank the committee again for taking their time, because as you can see by the presentations today, it wasn't easy reading through all of their presentations. And I was thinking this morning again, when I was looking to maybe, if you're thinking about it, Mr. Webb, Mr. Robert Webb, who founded Webb School, his